Hi, Psych 105 students. We're going to go ahead and get started talking about Chapter 3 today, talking about models of abnormality and how different psychologists look at abnormal behavior. So hopefully we can get through this pretty quickly. We've got a lot to cover. So the first, let's see if I can get my slides working here. The first thing that I want to say is what is really important to understand and why we're talking about models of abnormality is when we're learning about abnormal behavior. We've already, in our last chapter talked about what is abnormal behavior, and we're going to, throughout the semester, be talking about what are abnormal behaviors, what are psychological disorders, and understanding each of those. But they aren't just something that you can understand from necessarily one perspective. And so there are different kind of teams of psychologists who have ways of explaining behavior and have different ways of treating behavior based on how they explain the behavior. So we're going to go ahead and go through the different models of abnormality, and we're going to learn about those today. So we're going to learn about the different paradigms. So when we talk about paradigms, we're talking about like lenses or ways of thinking about abnormal behavior, and the different teams kind of that I always refer to them as kind of the teams that explain and treat abnormal behavior in different ways. So let's go ahead and look at the different models of how we look at abnormal behavior. And just keep in mind again how this is important for you to understand, so that and it's going to be helpful throughout the semester in understanding and explaining abnormal behavior and psychological disorders from these different perspectives. So today we're going to talk about the biological model, the psychodynamic model, cognitive behavioral model, the humanistic, existential model, and the social cultural model. So let's go ahead and get started. The first model or lens that psychologists use to explain behavior is the biological model. And this is a way of explaining abnormal behavior in terms of our biology. It could also be seen as kind of a medical perspective. So what we're doing is we're looking at behaviors and we're explaining them on a very physical, biological level. We're looking at things even down to a cellular level. Psychologists are very interested in studying the brain, and maybe you've already talked about the brain when you've taken a general psychology class or maybe a biology class, hopefully, or even the psychology course here at MJC on neuroscience. Regardless where you've talked about all of these things, the biological model, the psychologists who see behaviors on a biological level see that there is a biological basis to behaviors. And anytime there are abnormal behaviors, it's caused by some sort of malfunctioning part of the person in their brain, typically, either by the actual anatomy of the brain or possibly the chemistry of the brain. So when the biological perspective folks look at abnormal behavior, they're going to look at the brain chemistry, they're going to look at how the neurons are functioning, how the neurotransmitters are impacting the messages that are being sent from one neuron to another. And so different, there are dozens of different types of neurotransmitters, and if certain neurotransmitters misbehave or misfire, it can cause different mental disorders. Found that attention deficit hyperactivity disorder is related to certain amounts of serotonin levels. And of course, serotonin is considered a neurotransmitter, is a neurotransmitter. And, neurotransmitters are these chemicals that allow the neurons to they kind of allow the messages to go from one neuron to another. And so if there's a chemical imbalance, if there's some sort of increased amount of serotonin or dopamine or what have you in the brain, it can or a lack of those neurotransmitters, it can cause according to the behavioral psychologist, it can cause psychological disorders or abnormal behavior. And so another cause of abnormal behavior can be hormones and hormonal changes and imbalances. There's a lot of studies about the hormone testosterone and aggression, talking about the hormone cortisol, which is directly related to adrenaline. So when we get a bunch of adrenaline in our body produces the cortisol to help reduce that adrenaline, and then the cortisol remains in our body. But if we have cortisol, it can abnormally secreted in our body, it can end up causing things like anxiety and mood disorders. So there's the biological perspective, and I want to say biologists, but they are psychologists who study with this biological perspective, really look at how chemicals in the brain cause abnormal behavior. And so, of course, if they're looking at behavior in terms of the actual physical anatomy of the brain that could be causing problems, or the chemicals that are being secreted in the brain or in the endocrine system, the hormonal system, that are causing problems, then they're going to look for treatments that align with that. And so for the biological model, the psychologists who look at abnormal behavior from that perspective are often treating abnormal behavior or psychological disorders with drug therapy. So we see a lot of different kinds of medication, and that would be because there is a belief that this will change either the chemistry or the functioning of the hormonal systems or the brain. So we see drug therapy. We also see brain stimulation, so like electroconvulsive shock therapy, and even psychosurgery. And in our last lecture, we saw that kind of an older procedure that is done, which is the lobotomy, where the brain is severed. The ability for the brain, they sever I think it's the corpus callosum. This is the neural fibers that connect the two sides, the two hemispheres of the brain. Just things like that, where they will go in and actually change something in the brain to help reduce the symptoms or reduce the abnormal behaviors. So from the biological perspective, they see it from that very biological lens, and they also treat those behaviors in a very biological or even medical way. So that biological model is very medical in its kind of origin. And so in the 1950s, as we've talked about before, we had the advent of psychotropic medication, and there are medications that treat anxiety. There are anti-anxiety medications, antidepressants, anti-bipolar drugs, which are considered mood stabilizers. So when we say bipolar, it's like extreme highs and lows. And there are also antipsychotic drugs that are treated through, this lens of the biological model. There can be, like we said, psychosurgery. There's also brain stimulation. And so these don't happen as often, I think, as maybe they used to. I hear about these less and less, although I do hear of course, medication is definitely I don't want to say on the rise, but there's a lot of medication used in treating psychological disorders. But in some cases, ECT or electroconvulsive shock therapy can be helpful in stimulating parts of the brain that are less active, that need to be more activated, and that usually is for something like depression, severe depression. So there are biological treatments that treat these abnormal behaviors. So I want to give an example. I'm thinking of, for example, if someone is experiencing significant depression, and depression is going to be one of the first psychological disorders that we talk about in this class, I think because it's the most common and something that we're all kind of familiar with. So we're going to talk about that. So I'll bring up depression as an example and how in the biological model they might explain depression. And so for depression, I think we all kind of can relate or understand what depression is. Either you've experienced it yourself, or someone who has, or you've seen it on TV. But depression can be an overwhelming feeling of sadness and despair, loss of hope. It can mean a physical slowing down of the body, or maybe a feeling of agitation. You can have sleep disturbances and appetite disturbances, right? So all of these things are abnormal when they're all collectively together in this, diagnosis of depression. So someone from the biological model would look at depression and say there must be a lack of a certain neurotransmitter in the brain, and so we need to treat that with certain type of medication that's going to help us get more of that neurotransmitter, and is going to increase. So that would be an antidepressant medication. So from the biological model, we would explain depression in terms of what's going on in the brain, chemicals, and then we would treat it that way as well. We would provide treatment that way as well. So the next model of treatment and explanation of abnormal behavior is the psychodynamic model. And here we have Freud. Here he is looking at a statue of himself. I mean, I don't know. How would you explain this? But he's psychoanalyzing himself, it looks like. Anyway, Freud, of course, we know is the father of psychology. And his theories on psychology, he started out as a medical doctor, and he wanted to understand and help his patients who had no medical reason for their symptoms. And he understood that there must be something underlying it, and he kind of figured out that there was something mental, maybe without their even awareness, that was happening. And so he defined that as he developed this theory of the psyche, and he explained it in terms of the id and the ego, the ego, and the superego. You've probably learned about this before. I'm not going to go into a whole lot of detail about it, but his whole model of thinking is this psychodynamic model that we're talking about. And it says basically that it explains abnormal behavior from this perspective that it is a conflict that's happening unconscious, like out of our awareness, that's happening, a conflict between our id, our ego, and our superego. And he explained the psyche as we have a part of ourselves, and the psyche is kind of like the personality. It's the person who you are. So he explained it where the id is all about, it's the part of ourself that seeks pleasure only, that wants to have our needs met and is looking only for what we want and doesn't care about anybody else. And then he said there's another part of our personality or psyche that is the superego, and that's the part of us that's developed an understanding of what are the rules, what is moral and ethical and right, and where do I fall in this, and how can I do what I'm supposed to do, and what does a good person do, that kind of thing. So there's these two parts of our personality, one who says, I don't care what anybody thinks, I need to get my needs met. That's the id. And then there's the other part, which is the superego, that says, no, nice girls don't do that. You need to do this, right? This is what the rules are. And then there's the part of us, which is called our ego, which you've heard of the ego before, that helps us moderate between the two. And the part of us that says, okay, I need to have my needs met, yes, but I also need to go by the rules. And so our ego is constantly in this very uncomfortable space between these two tendencies that we have. And so according to Freud, what leads to abnormal behavior and psychological disorders is this extreme conflict between the id, the ego, and the superego. It can also be an overdevelopment of the id, or an overdevelopment of the superego, or an underdevelopment of the ego. And so he explained all of this abnormal functioning in terms of the id and the ego and the superego. And unfortunately, there's no way for us to look and measure and study scientifically the id, the ego, and the superego. But according to Freud and his psychodynamic perspective, he can explain a lot of behaviors through those terms. And so you could see how he may explain, someone, again, we'll go back to depression. He would explain possibly that someone with depression had an overly developed superego and never felt like an underdeveloped ego. So they have these rules in their mind, and they never, when they fail, they can't meet up to their expectations of what they think, and so therefore they start to feel depressed because they know what the rules are, but they don't have the ability to meet those rules or meet those standards that they have for themselves, or forgive themselves when they don't meet those. And that would be what the ego would do, would kind of offer that balance. So Freud and his psychodynamic perspective would also say that a large part of abnormal functioning comes from our past. It comes from past relationships. Specifically, he would say it has to do with how your mother treated you in childhood and whether your needs were met. So he would find that the cause of abnormal behavior was rooted in your childhood. It was rooted in subconscious and repressed sexual drives. And so he explained it, human behavior and abnormal behavior, in those terms. One of his very well-known and I think still used part of his psychodynamic theory is talking about ego defense mechanisms. So we know that the ego is the part of the personality that he explained was always in balance, or always checking and balancing between the id and the superego. And so sometimes the ego, when it's in conflict between, I have something that I want to do, but I know I shouldn't do, like the id saying, let's do it, and the superego saying, no, no, no. The ego sometimes has to distort reality in order to live with, the anxiety that is being caused. And those are called ego defense mechanisms. And so you've probably seen these before, but he defined abnormal functioning through these ego defense mechanisms. When he would work with a patient, he would say, he would identify when they were repressing something, or in denial, or projecting, or rationalizing their behavior, or there was displacement going on where they were blaming it on somebody else, or they were intellectualizing, or somehow regressing. So he would explain the abnormal behavior and could recognize abnormal behavior based on ego defense mechanisms that he could recognize. Another thing that Freud kind of pioneered was explaining abnormal functioning based on our ability, our development, and how we develop. And basically, he defined different stages of development as we grow up. And he said, when you're going from one stage to the next, from childhood to adolescence and so on, your id and the ego and the superego require some certain kinds of adjustments and development. And given the right circumstances and opportunities, you can successfully, develop that. If you're not given the right opportunity, if you're not given the right circumstances and support that you need in your developmental stages, then that also can make you fixated in that stage, and you become what he called arrested development, where you'll see a grown man acting like a teenager, right? Because they had some kind of trauma, so now they throw a tantrum like a teenager or a toddler even. And that's what he would call arrested development, where he would see, abnormal behavior based on unsuccessfully transitioning to different stages. So psychodynamic theories are really focused, when it comes to treatment, are really focused on uncovering any past traumas. So that's really important. It's also trying to uncover all the inner conflicts that are going on with the subconscious. So when a psychodynamic theorist says, okay, we can explain this abnormal behavior based on what happened in their past, the traumas they've experienced, the conflict between the id, the underdeveloped ego, and so on. So now that they've explained it that way, they've got to treat it and provide treatment that aligns with that kind of thinking. So the kind of treatment that a psychodynamic therapist might come up with for a person, it would be using psychoanalysis, basically. And psychoanalysis consists of probably what we all think of when we think of a therapy, right? When you think of the person who goes and lays down on the sofa and just talks and freely associates. That's what we call free association. They just speak whatever comes to mind and opens up this can of worms of information, and the therapist then interprets that. And the therapist is kind of like the expert on the person's life and interprets their dreams and what they say and all of those kinds of things. And the treatment then allows the person to experience catharsis and kind of re-experience some of their conflicts and traumas and all of that past thing. They can kind of work through it. That's what psychodynamic therapies are like and what they include. All right, so the next model that we are studying and explains abnormal behavior is the cognitive behavioral model. So the cognitive behavioral model really tries to explain abnormal behavior in terms of how a person has developed maladaptive behaviors or cognitions, and that has resulted in their abnormal behavior or their psychological disorder. So a person who has experienced depression, again, as an example, according to the cognitive behavioral model, there might be some thought patterns that they're going through that are not helpful or healthy, that are contributing or causing the depression. So they may be a very negative thinker and might be, catastrophizing and going through all of these kind of cognitive distortions, as a cognitive therapist would say. Or they may be behaviorally, they may be, finding that being depressed is more rewarding to them, and so they have continued to be depressed because it's the best way for them to handle the situation. They've somehow been rewarded by it. And so cognitive behaviorists look at what could be underlying the behaviors and trying to change that, and then what could be underlying in their thoughts to change those thoughts. When we look at really the cognitive dimension of it, it really focuses on understanding abnormal behavior in terms of the maladaptive thinking processes that people go through. You can look up, you can Google if you'd like, cognitive distortions, and really we can see all of the ways that we kind of change the story that we tell, and in terms of how we want to feel or experience it, and that change in how we tell it can influence how we feel. And so cognitive therapists will look for maladaptive thinking. They'll look for the kinds of thoughts that don't help people, that end up causing them to have these kinds of abnormal behaviors or psychological disorders. So I've actually got a really great video to show you. There is a therapist who's working with a very real client here, you'll see, and he is talking with her about her thoughts about what is happening to her. And so pay attention to how he focuses in the treatment of her through cognitive therapy. He's talking with her and he's focusing on her cognitions, her beliefs, and how she's thinking about things, and how that's influencing how she's feeling and how she's functioning.
But first, what we want to do is look at exactly what you have lost. Now that the worst has happened, you're afraid that David was going to leave you, and he has left you. And you feel as though there's been such a terrible loss, it's like a guillotine coming down on you. So let's see, in actuality, what you have lost in losing David.
I lost my best friend. No.
Okay. You lost your best friend. What else?
I lost something to talk to about all my feelings and thoughts. Although I have the time he didn't want to listen to them, but he still listens sometimes.
Well, half the time he did not even listen.
And we just walk out of the room. You know that we've been through that before.
Right. What else have you lost?
Well, I'm not sure yet in terms of, I don't know, financial support, moral support. I've lost the father of my children. I'm scared for my children not having a father now. I've read about what happens to kids when their parents split up, and I've lost that. I've lost my security. You know, I haven't been out working for years, and I don't know what I'm going to do. David's being such a bastard about money now. Like he makes a lot of money, but I think he's trying to work it out that I just get some sort of minimum thing. I don't know what he's doing. Well, I haven't gotten anything from him since he left, and it's been a month now. And I'm really worried about money. I don't know what I'm going to do. I don't have any income. I've got 2 kids.
Well, what is the thing that hurts you the most? Is it the money?
No. It's losing him.
Uh-huh. Now, do you think the loss of David is hurting more because of the symbolic meaning of the loss, or for what's been taken away from you?
I don't know which is more. It's probably both. Maybe it's more symbolic. I don't know. Maybe it's more on my hopes that everything was going to work out, that maybe it's losing my hope because I just kept hoping it would be okay. So maybe it is more symbolic than real. But it's still pretty depressing when you don't have any more hope, you know?
Well, it depends upon what your hopes are for.
Well, I hoped it was going to work out okay with us.
Right. So that's one hope that vanished. But aren't there other hopes that can come in and take their places?
I guess I'm not letting them come in.
You're not letting any hopes come in. In other words, when you look to the future, you're not even trying to think of ways in which losing David can be compensated for.
Who would want me? So,
That's all right.
I really love that video in demonstrating cognitive therapy because he does such a great job. And it just so happens that that therapist is Aaron Beck, who is basically the father of cognitive therapy. And he's really doing such a great job of helping her identify her thoughts that are keeping her in this cycle of depression. Obviously, she's going through a difficult time, and we can empathize with her. She's certainly, experiencing depression over the loss of her relationship, but he does a great job helping her identify, not identifying himself, but helping her identify. And she very much came to that realization that she's not allowing hopes into her life, that she is fixated on this person because the person represents security and represents, what is a healthy family life for her children, and just all of the things that he represented, a companion, and so on. And Aaron Beck challenges her by, saying, well, he didn't actually listen to you. Remember how he didn't listen to you? He kind of points those things out to help challenge her cognitions, challenge the way she's thinking about things so that she can see them in a different light. And she can also recognize that the thoughts like not and the way she's thinking that don't allow her to have hope for the future and that don't allow her to get out of her depression. So it's a great example of that. I really hope that YouTube doesn't ban me from posting that video on this lecture. Sometimes they do that and I have to edit it out, but hopefully that won't happen. So that is the cognitive perspective, really looking at things, helping clients recognize and then challenge and change those kinds of problematic thinking that have them stuck. And in depression, we see the way people think is a very important aspect of depression. And so a cognitive behavioral model is going to explain abnormal behavior or psychological disorders from how people think and problematic thinking. Of course, there's also the behavioral dimension of this. And so you've already learned, hopefully, about classical conditioning. You've learned about operant conditioning and different ways that we acquire new behaviors, right? Classical conditioning is where we acquire these physiological behaviors in response to things that we don't normally respond to. We learned about, in classical conditioning, we learned about how dogs learn to drool at the sound of a bell, right? They aren't normally drooling when they hear a bell, but as that bell is associated long enough with their food, just the sound of the bell makes them drool, right? Operant conditioning, on the other hand, is how we learn when we are rewarded. So we take on new behaviors when we get rewards or punishments, right? We stop doing behaviors when we are punished. And so operant conditioning can explain behavior, and a behavioral therapist or a behavioral model might explain depression, as I kind of mentioned at the beginning, might explain depression in terms of, there's something rewarding the behavior. Maybe every time you've expressed depression, you've gotten, or depressive thoughts, you've gotten a lot of attention and care, and that's something that you really want, but you haven't figured out a different way of getting that. Or maybe when you're depressed, that's the only time you can express how you feel, and or you feel comfortable sharing how you feel. And so that is another reward for the depression, and it perpetuates the depression. Another thing that behavioral therapists or behavioral psychologists look at is modeling. How have we learned the behavior? And there's a lot of research. In fact, of course, you've all heard of the famous Bobo doll studies where Alfred Bandura at Stanford University, showed children, an adult hitting a Bobo doll with a hammer and doing all kinds of aggressive behaviors toward this Bobo doll. And the children who had seen the adult doing those behaviors then modeled their own behavior after that adult. And the kids who had not seen the adults play with the doll that way were not observed to have those kinds of aggressive behaviors. So we see people acquiring behaviors from modeling as well. And so you could you could explain a depression from that cognitive behavioral model, even from a modeling perspective. We could say that someone who is experiencing depression has seen a lot of depression, who has, been modeled their behavior and their responses to different situations. They've learned it from people that they've been around. See, of course, that in the cognitive behavioral model, there's going to be cognitive and behavioral interventions to treat behaviors. If you believe that the behaviors are learned or are a result of problematic thinking, then the interventions and treatment are going to be directly for unlearning those behaviors, which can happen in, exposure therapy or systematic desensitization. We'll get into that a little bit later. But also those can be, through like cognitive therapy, where we saw Aaron Beck challenging thoughts, identifying thoughts that are contributing to that behavior. All right, so let's look at the humanistic and existential model. This is the model that looks at behaviors and says that abnormal behaviors come about very early in life and need to be treated so that people can self-actualize. And the humanistic viewpoint is that people are not able to achieve what they want to achieve, and their dysfunction ends up being caused by some sort of self-deception, or it can be through not, honestly recognizing what their weaknesses are. When we talk about existentialism, you're talking about, those kinds of questions about what am I doing? Why am I here? What's the meaning of life? Those kinds of questions. And so according to Carl Rogers was a very well-known therapist and theorist, psychologist in the humanistic kind of perspective. He talked about how each person needs to have unconditional positive regard. So they need to have total acceptance growing up, and positive interactions, an understanding that they are loved. And if there is a lack of that, then they have problems with their feelings of self-esteem and worth, and so it causes abnormal behavior later on in life. And so if he recognizes that abnormal behavior, psychological disorders come from negative family backgrounds, terrible parenting practices, somehow, somewhere along the line, not feeling a sense of worth, then he's going to say that treatment involves being a very supportive therapist, one that provides unconditional positive regard, one that provides empathy and is genuinely, really exudes this genuine care for the client. And very positive experience, of course, for the clients, and probably one of the more common types of treatment. Gestalt theory and therapy also is included in this model, and there are ways that there's a whole lot of techniques that people use to provide that kind of therapy, the Gestalt therapy, in this model. And one of those is in therapy and treatment would be to do things like role playing, or to set, so for example, someone who is experiencing depression. And according to the humanistic, we're going back to depression again as our example, someone who is from this humanistic or existential model of abnormal behavior would say that their depression stems from not being able to self-actualize in their life. It comes from not being regarded in a positive light when they were young. And so, so they might have in therapy, in treatment, they might help the client work toward their own recognition, and challenging them to see their things that they've overcome. And also maybe might employ a technique of role playing, for example, where they might sit down and say, okay, let's imagine that your mom is sitting here now. What would you want to say to her? And so engaging in those. Or if you were your mom, what would you say to you now? And providing that kind of outlet, that would be the humanistic existential model. So treatment is very much around providing that unconditional positive regard to treat abnormal behavior. All right, the last model that we're going to talk about today is the social cultural model. And this is one that establishes that any abnormal behavior or psychological disorder comes from the differences between the norms and roles that someone has in society and the conflict that's happening there, based on, it can either be the society or the roles that someone's expected to have, or maybe they're not meeting in terms of their culture. And so there's two major perspectives within that. There's the family and social perspective, and then there's a multicultural perspective. So looking at treatments for each of these kinds of models. For the social cultural model, we see treatment can be through group therapy, it can be through family therapy, it can be through couples therapy. And so anytime we have groups or families or couples working together, it's recognizing that abnormal behavior is part of a system. and it's coming out of a system of some sort, that there's some sort of, because we are not individuals working in a vacuum, because we are individuals who have people around us who are influencing how we feel and how we behave, and there are dynamics within families that are dysfunctional that cause abnormal behavior. Treatment then needs to be focused on recognizing the behaviors that are going on in the family and treating those. And so rather than looking at the client as having the problem, they look at the client as being a symptom of the problem. And the problem is actually the system that is working and creating these abnormal behaviors and psychological disorders. Same can be said for the multicultural treatments. You're looking at what is happening within the culture, what needs to change in terms of cultural sensitivity to help this person adjust and adapt and change the system around them to help them establish functional behavior again. So really interesting, very effective. I've used a lot of group therapy and family therapy, and I used to kind of specialize in couples therapy when I was working in private practice. And you see how the dynamics within a family can really impact, and then couples can really impact individuals' behavior. And so when we look at something like depression, again, our go-to example for each of these models, if someone is in a family, for example, and is brought to therapy, oh, this person is experiencing depression, a social cultural model would say, okay, what's going on in the entire family dynamic that's contributing to this situation? Because this person is a symptom of the problem, not the problem. And so you may see, oh, well, we have a father who is abusing alcohol, who is not emotionally present, who is not responding or to the needs of the family, and is causing additional strain. And this is the only way this person knows how to cope, is to kind of shut down and retreat into depression. So that could be just an example of what could be causing the depression. And a treatment approach would be to look at the whole system and how it's functioning, and hopefully get that person treatment and change the dynamic that's happening within the system. It's a very difficult way of treating. I think I'm speaking from a provider kind of perspective. It's difficult to get everybody there, but man, it's so effective. So effective. I've seen a lot of really good progress with people who have family therapy. I'm thinking another example was one we already watched of the city of Geel in Belgium, where you look at the society and the culture who's really taken in people with severe mental illness and seen such a decrease in their episodes of crisis and in their psychotic episodes. So we're looking at how the culture really embraces and normalizes the behavior and the treatment of those folks. So that would be another kind of social cultural model. So in summary, I've got this comparison chart here to really look at some of the differences between each of the different perspectives that we talked about. We've got biological, psychodynamic, cognitive behavioral, humanistic, existential, we kind of put them together. Family or social and multicultural, we also put those kind of together. So when we're comparing the models, you can look at how they describe behavior. So each of these different kind of teams will describe abnormal behavior from a different reason. They'll say, okay, the biological group is going to say it's some sort of biological malfunction. The psychodynamic group is going to explain the behavior as some sort of underlying conflicts from your childhood or between your id and your ego and your superego. The cognitive behavioral group is saying, hey, these are maladaptive. In other words, you've acquired these behaviors, but they're not helping you. Or there's thinking, a maladaptive thinking. Also then the humanistic and existential say, okay, these folks are avoiding responsibility or have self-deceived themselves, and it's based on their history of not having unconditional positive regard. And then we see the family or social or multicultural issues that say that the cause of the dysfunction is actually from family or social stress or some sort of external pressures from the society and themselves. And then we can go down here and look at, this is how then the goal for therapy or the goal for treatment is established based on which which model that you're looking at the behavior from. All right, so from here you're going to go ahead and enter into back into Canvas, and you're going to look at the lecture quiz for chapter number 3 and complete that. All right, guys, thanks.